Testicular lumps and swellings can be concerning and warrant careful evaluation, as they can indicate various conditions, including testicular cancer, infections, or benign non-cancerous conditions. Understanding the potential causes, symptoms, and when to seek medical attention is crucial for timely diagnosis and treatment. Common causes of testicular lumps and swellings. Testicular cancer. Description: the most serious cause of a testicular lump. Testicular cancer often presents as a painless lump or swelling in one testicle. Symptoms: in addition to a lump, there may be swelling, discomfort, or a feeling of heaviness in the scrotum. Epididymal cysts. Description: these are fluid-filled sacs that develop in the epididymis, the coiled tube at the back of the testicle. They are typically benign and often do not cause symptoms. Symptoms: generally painless. They can feel like small lumps on the testicle. Hydrocele. Description: the hydrocele is a buildup of fluid in the sac surrounding the testicle, leading to swelling. Hydroceles are usually benign and often resolve on their own. Symptoms: swelling in the scrotum, which may fluctuate in size and is typically painless. Varicocele. Description: a varicocele is an enlargement of the veins within the scrotum, similar to varicose veins in the legs. It is often associated with infertility. Symptoms: may feel like a bag of worms and can cause discomfort, especially when standing. Inguinal hernia. Description: an inguinal hernia occurs when tissue, such as part of the intestine, protrudes through a weak spot in the abdominal muscles. This can appear as a swelling in the groin or scrotum. Symptoms: swelling that may be painful, especially when bending over or lifting. Infections. Description: conditions such as epididymitis, inflammation of the epididymis, or orchitis, inflammation of the testicle, can result from infections, commonly caused by sexually transmitted infections, STIs, or urinary tract infections, UTIs. Symptoms: pain, swelling, redness, and warmth in the affected area. May also cause fever and discharge. Testicular torsion. Description: the medical emergency where the testicle twists around the spermatic cord, cutting off its blood supply. This condition typically occurs suddenly and requires immediate medical attention. Symptoms: severe, sudden pain in the scrotum, swelling, nausea, and vomiting. Symptoms to watch for: if you notice a lump or swelling in the testicles, it is important to be aware of accompanying symptoms, such as pain. Any pain in the testicle or scrotum should be evaluated. Swelling. Sudden or persistent swelling can indicate the problem. Changes in size. Noticeable changes in the size of one testicle compared to the other. Heaviness or discomfort. The feeling of heaviness in the scrotum may indicate an underlying issue. Changes in texture, hardness, or changes in the texture of the testicle. When to seek medical attention: it is essential to seek medical attention if you experience any of the following: the new lump or swelling in the testicle, especially if it is painless; persistent pain or discomfort in the testicle or scrotum; swelling or lumps accompanied by fever, chills, or unusual discharge; sudden onset of severe pain or swelling potentially indicating testicular torsion. Diagnosis: when evaluating testicular lumps or swellings, healthcare provider may conduct the following: medical history and physical examination. A thorough history and physical exam, including palpation of the testicles and scrotum. Ultrasound. A scrotal ultrasound is the primary imaging test used to assess testicular lumps. It helps differentiate between solid masses which may be cancerous and fluid-filled sacs. Blood tests. Blood tests may be performed to measure tumor markers such as alpha-fetoprotein, HCG, and LDH that can indicate testicular cancer. Surgical exploration. In some cases, if the diagnosis is uncertain, surgical exploration and biopsy may be necessary to obtain a definitive diagnosis. Treatment. Treatment for testicular lumps and swellings will depend on the underlying cause. Testicular cancer. Treatment usually involves surgery or cystectomy, possibly followed by chemotherapy or radiation therapy, depending on the type and stage. cysts and hydrocele, typically monitored if asymptomatic. Surgical intervention may be considered if they cause discomfort or complications. Varicocele, if symptomatic, surgical repair may be recommended. Infections, antibiotics or antiviral medications are used to treat infections like epididymitis or orchitis. Testicular torsion requires immediate surgical intervention to untwist the testicle and restore blood flow. Self-examination. Performing regular testicular self-examinations is crucial for early detection of lumps or abnormalities. Here's how to do it. Timing. Perform TSED once a month after a warm shower or bath when the scrotum is relaxed. Technique. Examine each testicle by gently rolling it between your fingers. Look for lumps, swelling, or changes in texture. Check for any discomfort or abnormalities. Report changes. If you notice any lumps or changes, consult healthcare provider promptly. Conclusion. Testicular lumps and swellings can result from a variety of conditions, ranging from benign to serious. Awareness of the symptoms, conducting regular self-examinations, and seeking timely medical evaluation are essential for effective management and treatment. If you have any concerns about testicular health, it is important to consult a healthcare professional for guidance and assessment. Early diagnosis often leads to better outcomes, particularly in cases of testicular cancer.